Well, good afternoon. I can tell you that it's not easy to just snap your fingers and move somewhere else, but if every American had the ability to leave from where they are to come to Naples, many would do it. I can tell you that. It's a great place to be, and we're really glad to be here at Premier Place at the Glenview, which was recently awarded a Gold Seal Award for Excellence in Long-Term Care. So thank you for doing that, and we know how important it is. And yeah, platform. We've got a great group of folks here today. We have our Secretary for the Agency of Healthcare Administration, Secretary Simone Marsteller. We have the Surgeon General of the state of Florida, Dr. Joe Latapo. We have our, clap for him, he's good. He's not officially, but maybe they'll make him a contributor to Tucker Carlson's show soon. We'll see. Does a great job on all his appearances. We have our incoming Senate President, our great senator from here, Kathleen Passidomo. And from North Florida, who was actually with me yesterday doing an announcement right basically on the Florida-Georgia border we were at, and is now down here covering the entire state with this bill that we're going to sign today, Representative Jason Schoff. So I want to thank him for doing it. And then we also have from Miami, Senator Ileana Garcia, who was one of the sponsors of this bill, and then two local representatives, Bob Rommel and Lauren Mello. So I want to thank them for their hard work. And then we have two folks who are going to speak about the importance of what we're doing today. We have Lieutenant Colonel Doug Madigan and Charlene Miranda, and they're going to share their stories about the importance of what we're doing here today. I mean, I think if you look back over the past 2 years, one of the most heartbreaking elements of this was shutting people out of being with their loved ones at really critical times in their lives. And we worked very hard to make sure that in long-term care facilities we had visitation. I think we were the first state in the country to do that. Almost 2 years. I think it was August of 2020. We worked very hard with our hospitals to tell them, yes, I understand you're trying to mitigate COVID, and that's important. But you can't just shut out all these human interactions for people who are in the hospital and have really difficult circumstances. And I can tell you, if you take people and they have that connection and they have loved ones with them, they are more likely to recover. Don't tell me that that's not true. And so you can't just shut out every type of human interaction because you're dealing with a respiratory virus. There's nothing wrong with taking precautions and if they want you to wear PPE, but to not let somebody be there with their loved one, end-of-life situations, to lose a family member and be shut out of being able to go into the hospital, that is fundamentally wrong. To have other instances where you have people that are going to get treated and to not have a spouse or a parent. This is really, really difficult. And yes, obviously there were people that were hospitalized for COVID. There's people hospitalized for many other things. And yet they were not allowed to have people in many parts of this country for a long time. And so I think most of the hospitals in Florida, most of the long-term care facilities have tried to work constructively to do that. But we understood that, look, COVID is never going to be eradicated from the earth. That's just not the way it is. These viruses circulate. It's going to become it's going to be an endemic virus. And I think a lot of people have had it, and there's a lot of protection out there. So hopefully the clinical impacts are going to be less as we go forward. But it comes and goes in waves. There's times in the south over the summer. In the north, you have big waves in the winter. And we don't know how that's going to go. But regardless of that, that cannot be used as a justification to separate loved ones from each other, to deny somebody who's in the hospital the right to have their spouse present or their children present. And so we thought that we needed to make sure that Florida was leading the way on this to protect patients' rights, to make sure that as somebody who, if you're hospitalized or you're in a long-term care facility, you have the right to have your family members present with you. And we have to stand up and say that. And so actually under the Trump administration, they had suspended visitation in nursing homes, and then they put that back in 2020. We obviously did that even beforehand. We were ahead of the curve. But you know, HHS and the federal government, they've yet to reinstate visitation protections for patients in hospitals nationwide. And so you usually have protections. They're not as strong as what I'm going to sign into law today, but they're usually as federal protections, and they have basically suspended those protections. And so you have some parts of the country where people still aren't able to get in and see their loved ones in these certain circumstances. And so what we're doing here today is underscoring and solidifying in Florida law these really significant rights for Floridians. And so the bill that we're going to sign today is called the No Patient Left Alone Act. And it increases patient protections and ensures Florida families have a fundamental right to visit their loved ones receiving care in Florida hospitals, hospices, and long-term care facilities. The bill bans facilities from requiring visitors to show proof of COVID vaccination. You know, there's some places that, you know, people have COVID, they have immunity, so they're not getting vaccinated, and then they're being denied the ability to go into these places. Meanwhile, you could have other folks who have not had COVID, and their protection isn't even as strong. So we wanted to make sure that was good. Also, policies cannot prohibit physical contact, such as hugging between their loved ones. They would actually police this, where you go in and you said, okay, you may be able to go, but you can't give your wife a hug, or you can't give your kid a hug. I mean, give me a break. And so we need to be able to protect that. This ensures families can be there and patients can have their support system around them when it matters most. And I want to thank our First Lady, my wife, for all the work that she did to get this bill across the finish line. You know, we've, over the last 6 months, experienced this firsthand. And I was, you know, I would go with her to her chemotherapy and when she was in the hospital, and you're there. And I can tell you, if I had not been there, it would have been more difficult for her. I mean, you know, you need to have the people that you love there with you. And so we were fortunate to be able to do that. But I think that should be the expectation, you know, that you have that. And then if I mean, just imagine, like, we have young kids. I mean, what, you're not going to let both the parents in to be, if you have a kid that has a problem? So this is really important. And I know that this was something that was really meaningful for her. And I think that she did a really good job. But isolating people is not healthy. That is not the right thing to do. And making sure that we're facilitating the connections that really make life worth living is something that's very, very important. And you have these situations, even if it's more of a routine hospitalization, just the fact that support system's there means an awful lot. And then, of course, you know, we do have these situations where someone comes to the end of the road, you have an end-of-life situation, and to be able to have all the family present, to be able to say goodbye, that is so meaningful, and to deprive them of that is really, really bad. And so that's not going to happen in the state of Florida. And I do want to say we've had a lot of hospitals that have really worked constructively with us on this, because I think they understood how significant this is. And I think it's the right thing to do. I also think, just from a healthcare perspective, you know, I think it does lead to better outcomes to have this support. You got enough going on when you're in the hospital for something, and the last thing you want to be is just sitting there wondering where all your family is and be lonely and isolated. So this was a good bill. This is a bill that I'm really proud to be able to sign into law momentarily after we hear from some of our folks. And I hope that the federal government will reinstate the protections federally that they've had. I mean, it's been 2 years now with this. Have some families that will not be allowed to be together at these critical moments anywhere in our country is a real sad commentary on the state of affairs that we see. So Florida's not going to be denied that. We're going to make sure that we're fighting for our patients, and that's what we do here today. We've got a lot of great people that are here to be able to offer some comments. And so we're going to start with our Secretary of what we call ACA, that oversees all the hospital system and the nursing homes in Florida, Simone Marsteller.
Governor, thank you very much, and good afternoon. I want you all to know, if you don't already know, that compassion and caring for the people of the state of Florida is what drives this man. I see it every day. I work for him, and compassion and caring, quite candidly, is what this bill is all about. The governor and the First Lady are champions for our Florida families and for all of our citizens. And as you heard the governor say just now, not letting people have visitors and have their loved ones with them at a time when they need family around them the most is unthinkable. And so the governor, the First Lady, the legislature, we all understand, and this is what this bill does. It gives individuals the fundamental right to have a visitor in the hospital, if you're in the nursing home, if you're in an ALF or any other long-term care facility. This is just another example of this governor's continued effort to make sure that Floridians can make the decisions that they need to make for themselves and their families when it comes to health care, as opposed to being told what we have to do, what we can do, and what we can't do. We know that in cases in which, as the governor has mentioned, when folks are in the toughest situations that they're in, that family members, loved ones, physical contact, there's nothing that can beat physical contact. Seeing somebody on an iPad, not going to do it. We need to make sure, and this bill makes sure, that individuals in hospitals, long-term care facilities can have that. So I want to just give you all sort of an idea of this, a little bit of the specifics of the bill, and then let you know what my agency is doing to make sure that this bill, when it's enacted into law, is going to do exactly what we expect it to do. So, from the moment that the governor signs the bill, the facilities that are covered are going to have 30 days within which to develop visitation policies, if they don't already have them, that ensure that individuals can designate an essential caregiver. That individual is allowed to visit no matter what, and in addition to any other visitors that are allowed. Visitors are going to have to be allowed for a variety of situations. End of life, if an individual who was living with family before entering a facility is having difficulty and struggling with a change in environment, if the individual has to make a very important healthcare decision, you want your family with you, right? If an individual is experiencing emotional distress or grieving the loss of a friend or family member who recently died, if a person needs cueing or encouragement to eat or drink, which was previously provided by a family member or caregiver, if someone who used to talk and interact with others suddenly now is seldom speaking with individuals, that person certainly needs to have visits from family members and loved ones. Certainly, as it relates to hospitals, in situations of childbirth, visitation has to be allowed. And finally, pediatric parents. As a mom, I can only imagine how I would feel if my child were ill and in a hospital and I couldn't see her. And let me just say, my child is 38 years old now. But I still would want to be with her if she's in that kind of situation, wouldn't you? Absolutely. So Senate Bill 988 makes it clear that healthcare facilities have to allow in-person visitation, and as the governor mentioned, cannot require procedures and protocols that are any more stringent for visitors than they would be for staff. So what is my agency doing to make sure that visitation is open and available to everyone? Two things. Number one, hopefully by the end of today, if not by the end of today, tomorrow, my agency is putting a dedicated web page on our website to let everyone know exactly what the fundamental rights are that are provided by this bill and how to go about submitting a complaint should anyone be denied visitation with their loved ones. And I'm happy to announce that my agency has a dedicated toll-free number for visitation complaints, and that is 888-775-6005. So if you don't want to make a complaint online, you can call that number, and we have people ready to assist. And I need for you all to know, but also the facilities that we regulate to know, that the Agency for Healthcare Administration is going to be surveying these facilities to make sure that they have their policies in place, to make sure that the policies are posted on their websites, and if those things are not done, they are subject to being held in violation of the law. We know how important visitation is. We have always been, throughout the pandemic, we have been dedicated to making sure that people can see their loved ones. We're going to continue to stand ready and stand guard to make sure your fundamental rights are protected. So thank you, Governor, and thank you all.
Thank you. Okay, Florida Surgeon General, Dr. Joe Latapo.
Good morning. Good afternoon. Yes, yeah. I don't know how long I can keep using my 3 kids as an excuse for being disoriented about the time of day. But, you know, the bill that we're discussing is very important because of what it does and also because of what it demonstrates. And in particular, what it demonstrates is that we went through a time period in this country where crisis and emergency became an excuse to treat human beings as something less than human beings. That's what happened when individuals, leaders of hospitals, leaders of other institutions such as nursing homes, decided that it was okay to deny people who were sick, in pain, confused, afraid, or dying, access to contact with those people who they love. That was a dehumanizing measure that virtually every healthcare facility in this country decided it was okay to implement due to a crisis. So crisis will never be a reason for us to treat other human beings as being less than human. And this bill says that that's absolutely going to be the case. And I appreciate this bill for that reason. Because, frankly, even though we've gotten through sort of what appears to be the worst of the COVID pandemic, we know that we're not done with crises. And it's important to identify the thing that was wrong so that when the next crisis comes, we can't, leaders can't just go back to that same type of behavior and excuse themselves for it due to a crisis. I also want to highlight something that Secretary Marstiller said, which is, as I was standing here listening to the governor, he used the word heartbreaking. And that actually, that I think characterizes one of the reasons why so many people in this state, in all the states in this country and around the world, admire him and are appreciative of him, because it was heartbreaking. That is that's the core element of that decision to separate people at the time of their greatest vulnerability from contact with other people that meant something to them, that helped them feel safe and grounded to being human and to being on earth and everything else. And and that our Governor DeSantis can voice that with integrity, with complete genuineness is one of the things that makes him so special. And I think many of us realize how special it is. And it's also amazing that so much of our future, in terms of the course that we lay out, sort of emerging from the worst parts of this pandemic, are dependent on leadership, and frankly, on his leadership, which is just an amazing thing to say, that so much can be on one person's shoulders, but I know he can handle it. But it's true. And paving that path for this and for other decisions that basically hurt people who shouldn't have been hurt, whether it's what happened with schools, whether it's what's happened with families that have lost opportunities because of a crisis, because of a pandemic. Finding our way out of that so that we can avoid making these types of mistakes in the future is probably the most important thing that we can do right now. So we're at a special time. We have special leader, and Secretary Marstiller is also awesome, and she will make sure that this gets done.
All right, so we're going to hear from a couple folks. So Charlene Miranda, are you here?
Good afternoon. My name is Charlene Miranda, and I am, you can't hear me? Okay. Is that better?
Can you see it?
Can you hear me?
Do
No?
you want to hold the mic maybe?
Sure I can.
Try it now.
Is that better?
Okay.
Great. My name is Charlene Miranda. I am a wife, a mother, and a breast cancer survivor. I was diagnosed with stage 3 breast cancer just 9 months after having a baby. I went through chemotherapy. I was hospitalized multiple times, all alone. During one of my several hospitalizations, I was in borderline critical condition. And while I've always thought of myself as someone strong-willed, with a passion for life, a zest, and a will to live, I can tell you being alone in the hospital without my husband almost made me lose that will to live. And I never want that to happen to anyone again. And unfortunately, so many thousands of patients just like myself were all alone during hospitalizations and or chemo. And so I want to thank our governor and First Lady Casey DeSantis and our Florida legislators to make for passing this bill to make sure that this will never happen to patients and to anyone going forward in the future. Just because you only get one life, and it's important to be able to share those moments, especially when you're in need of having your loved one with you there. Thank you.
Okay, Doug Madigan.
Thank you. My situation was quite a bit different because of timing. The governor had already started opening things up. So in 2021, my wife got to take advantage of a lot of PT and OT for her Parkinson's, PT for lymphedema at the Cape Coral Vocational Rehab Facility. And then on 17 November, she had a stroke, and got the paramedics there, took her to the Gulf Coast Medical Center, ER. When I got there, she was on life support, which she wasn't when she left. My first question was asked, brain surgery is the only thing that might save her, and my wife and I already did living wills, and that was not part of what we thought was right. A nurse said, "Let me get you the chaplain." He was a rabbi. I'm Catholic. He was great, but he said, do you want a Catholic priest? I said, yeah, just help me. So, made the decision, no surgery. So they moved my wife to the ICU. One of my sons was in town, so he was able to join me for that. Great nurse. She explained the next steps, and she said, it's probably good for you to go home and get all your family here for tomorrow. I did. All of them. In the same room. When you're on life support, you still can hear. We all agreed after individual and group visiting that it was time to turn off the life support. You don't know whether the person will live or not, or breathe. She did. Her heart was strong. So we went home that night, got a call the next day. things were getting worse. Everybody, the doctor, the nurse, the hospice man, everybody figured that she would probably pass away by noon on the 19th. She didn't. Finally, we went home about 6 p.m., said, we'll see you tomorrow. But the doctor had told us, sometimes when they're alone, nobody around, they decide it's time. An hour later, that's what happened. Right, but we got treated very well. Thank you, Governor.
Okay, Senator Ileana Garcia.
Muchas gracias, Gobernador. As you can see, this is a very sentimental subject, so I'm going to read from my notes. You know, No Patient Left Alone is about protecting human dignity and compassion. It makes clear that in Florida, at a person's greatest hour of need, there will be a loved one by their side. During the pandemic, I heard of so many families, heart-wrenching stories, frustration, because they could not be with a relative who was hospitalized for whatever reason. We all know of people who sadly died alone, unable to feel the warmth of a loved one's touch or a final goodbye. This is unacceptable, and this law makes certain that this will never, ever happen again. It was an honor to successfully shepherd the No Patient Left Alone Act, along with Representative Jason Schoff. I'd like to also thank Kathy Mears and the rest of the senators that helped me through this process. Extremely grateful also to Governor DeSantis for his support and leadership. And if you don't mind, I'd like to say it in Spanish for you. So I don't know if there are any Spanish-speaking people here. Oh, okay, perfecto. Bueno, the No Patient Left Alone Act, ninguna persona, ningún paciente se queda solo. Se trata de proteger la dignidad humana y la compasión. Dejan claro que en Florida, en el momento de mayor necesidad de una persona, habrá un ser querido siempre a su lado. Durante la pandemia, escuché de tantas familias desconsoladas y frustradas por no poder estar con su familia en un momento tan crítico como una enfermedad o en sus últimos momentos. Todos sabemos que personas, lamentablemente, murieron solas, incapaces de sentir el calor de sus familiares, el no poder decir ese último adiós. Eso de ahora en adelante es inaceptable y por eso esta ley asegura que eso nunca volverá a pasar. Fue un honor guiar con éxito esta propuesta de No Patient Left Alone, ningún paciente se queda solo, junto al representante Jason Schoff, y estoy muy agradecida con el gobernador DeSantis por su apoyo y liderazgo. Muchas gracias.
Okay, Representative Jason Schoff.
Thank you, Governor. Well, I think that the subject, the reason we're here today has been covered very well. We've got excellent leaders in this state that have helped push this issue forward, from the governor and the first lady personally getting involved and putting all of their horsepower behind it, to our great senator, and back home, a lady named Mary Daniel, Clay Yarborough. There's just a whole that really went all. And I can tell you that throughout the process, there has been nothing better than to be able to give a call back to the constituents that called me during the lockdown to let me know what was happening and let them know your governor has your back, your legislature has your back, and going forward, we won't be dealing with this again. So thank you.
All right. Okay, I'm going to put the John Hancock on the bill and we'll make it official. Today is April what? 6th? All right. Protecting patients' rights. Dignity. Okay, today is April what? 6th? All right. Today is April what? 6th? All right. All right. Protecting patients' rights. Dignity. 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 Dignity got one more. Who wants it? Anybody? She's got a good jacket. Thank you. Good stuff. Well, I just want to say, really, really happy to be able to make a difference. There are different things, that happen. Some of them get more attention than others. I would say not being able to visit it has not gotten the attention it deserves. I mean, I think there was a effort. I think the media was very pro-lockdown. That was viewed as something that was the right thing to do. Obviously, it wasn't. And so, but these stories are so powerful. And when people are separated, when they're not allowed to have the loved ones there, that has really incalculable damage. And, the fact that, we listen to Doug, I mean, you hate to be in that situation, but if you have to have that, and we all eventually have to have that, don't you want to be able to have your family there and your loved ones there? So in Florida, you have that right in law, and I think what Dr. Latapo said is correct, that yes, our hospitals by and large have been working well with this. This is something we started talking about a lot. Really, I was probably the first governor, to say, guys, you need to be letting our folks in to see their loved ones. And it's not just end of life. I mean, you have a teenage kid that breaks a leg, they need to have their parents in there with them. Like, yeah, that's not going to be a fatal thing, but that's important. It's a traumatizing thing to be hospitalized or to have some stuff like that. So we're proud of doing that, but we also recognize that, we were all sitting here 3 years ago, and I had told you that there would be governors in this country that would lock little kids out of school for a year, shut churches down. There were states in this country that shut churches down, but yet they have liquor stores and strip clubs open. Who would have thought that would ever have been acceptable in the United States? And so I think we've seen that if you're not vigilant about some of these things and you have the wrong leaders in place, you can have some really bad decisions. And so, hopefully there would be no retreating on this in the foreseeable future. But if there is another crisis, I think it's important that we not lose sight over things that really matter. Don't let people whip up fear so much that you're depriving people of basic human dignity. And I think that this bill today really creates, cement around those rights. And so as different things and the currents of life and different issues that come up, as those go back and forth, these rights to be with your loved ones are fundamental, and they're not going to be ignored. And so that's a good day for the state of Florida. And again, we're leading on this where other states, have not been willing to do so. And why not? I mean, we've been leading on a lot of other stuff that we're very proud of. We have right now, we have the largest budget surplus in the history of this state by a country mile, not even close. If you look at the state that's closest to us in population is New York State, they have 3 million fewer people than we do. The budget is over twice the size there, taxes through the roof, and yet we have better roads, better infrastructure, higher performing K-12 schools, and our public university systems ranked #1 in the nation 5 years in a row by U.S. News and World Report. And we do all of that with no income tax and the lowest per capita tax burden in the United States. So that's what you call leading. You look at what a lot of these other cities were doing, how horribly they were treating the police over the last couple years. They were cutting funding for police. They weren't supporting the police. And you saw crime skyrocket in places like Seattle and Chicago and Minneapolis and New York. And what did we do in Florida? We never stopped supporting people in law enforcement while other areas were defunding or cutting funding. Last year, we did a $1,000 bonus for every single firefighter and police officer in the state of Florida. And then we thought it was good, so we got the legislature to put it in the budget again for this year. So 2 years in a row, every single person that wears the uniform is going to get a $1,000 bonus check from us. And you notice we don't allow what they do in like New York where they don't have any cash bail. So they put the criminals right back on the street. So someone will get arrested for a sexual assault, they'll put them right back on the street, and then they end up committing other crimes instead of being put behind bars. And so, in Florida, we don't believe in that. We believe in holding people accountable when they violate the law, and we're not going to let the criminals take the upper hand over the victims of crime. And you also saw what we did last year. We signed a bill, as all these other places were defunding law enforcement, we signed a bill saying that in Florida, we're not going to let any local government defund law enforcement. If they try to do it, we will put the money back in so that people are safe. And I think having those messages, that's part of the reasons why so many of these police officers want to move to Florida. And oh, by the way, on Friday, I signed a bill that's even going to open the floodgates more. We said that a lot of people have not, it used to be very hard to get a job in law enforcement. People wanted it. Now they're treated very poorly by the media and by others, that it's harder to recruit. We have a better job in Florida because we have a very law and order culture, but there's vacancies. And so you have people that are being treated horribly in Seattle, Minneapolis, New York, all these places. And so what we said is anyone who's new to law enforcement in Florida, either one of our young people that decide to go in as their first profession or transferring in from these other cities and states, if you do that and take a position in Florida, we now in law have $5,000 signing bonuses for all of those folks who come and fill these positions in Florida. So that's going to make a huge, huge difference. I'm very concerned about what Biden has done at the southern border. Since he's been president, they've had 2 million come in illegally across the southern border. I had helped send some people to help Texas last summer, and I went down there and visited. They're coming from all over the world. We saw Libyans, we saw Haitians, we saw people from the Middle East, South America, you name it, they were coming. And what's happened is you've seen the biggest increase in human trafficking, sex trafficking, and drug trafficking than we've ever seen in the modern history of our country. The number one cause of death, like one of the main things they're bringing across the border is fentanyl. The number one cause of death between people 18 and 45 in the United States of America is fentanyl overdose. And so when you have that flow coming in, that has a direct impact on communities all across this country with the fentanyl. And I think it's been a disaster. But what they're now doing is they're going to get rid of what they called Title 42. So the people that they were stopping, now even they're going to be able to come. And so I think those numbers are going to increase starting at the end of May. So that's not good policy for this country. And so what we're doing in Florida is saying, we're not going to let the recklessness of those policies impact our state. So we do not, if businesses or if contractors are dumping people who are illegal into Florida from southern Texas, we're going to go after their ability to do business in Florida. If Biden is dumping people, which he has dumped, people, they fly them in at 2 in the morning. They haven't done it lately, but they did it many months ago. We now have money where we can reroute them to sanctuary states like Delaware, and we're that to make sure that we're keeping people safe here. We're also very happy with what we're doing with education. We have now, since I become governor, Florida is now ranked number 3 in the latest Education Week rankings for K-12 achievement. And that used to not be the case when I was growing up in Florida. And so part of what we've done is, we have the most robust school choice in the country. Parents, low-income parents, have opportunities to go. We've got a lot of opportunities within the public school system, like the charter schools. And then we just did the biggest increase in teacher compensation in the history of the state of Florida in this budget that I'm about to sign. And so we're putting an emphasis on American civics and making sure people understand why this country was founded and the principles and all the key things about that. And that's going to be real history, and we're not going to have indoctrination in our schools. We're going to have education in our schools. And we're also going to continue to do more with workforce training and skills-based education, vocational education, because there's a huge demand for these skills. If you're a machinist, or you can drive trucks, or you can do all these things, you make really, really good money at a very young age. And we have a lot of students that have gone to colleges and spent a lot of money, and they end up in these degrees that are like, zombie studies degree, and then they end up working in a job they could have had out of high school. And so we're proud of our higher education system. We don't let them raise tuition, so it's actually affordable. But some of these private colleges are very expensive, and I think some of the students have been sold a bill of goods that just go into debt infinitum, and if you get a piece of paper, somehow magic's going to happen. That's not true. You need to look to see how can you prepare yourself to be able to do well in society. And so we've added 50 new apprenticeships throughout the state of Florida. We have more folks going to things like truck driving. We've expanded a diesel mechanic program, all these different things that are not only giving the young people more opportunity, but quite frankly, make Florida a more attractive place for people to bring manufacturing. And we've had people move since COVID, and we have even more, some major manufacturing that we're in the process of bringing to Florida. So that's really, really exciting, but it's an example of how being serious about education, but particularly workforce education, that can then make your state even more attractive to expand your industrial base. And so we're going to have some great announcements over the next 4 or 5 months along those lines, and I'm really looking forward to that. And you know, we're fortunate to be in a free state. I can tell you that folks that are in, and I get a lot of correspondence into our office, the people will write in from other states thanking us for what we're doing and leading on all these different issues, including parents' rights and making sure that parents have the primary seat at the table. So we're going to keep doing it. We got a lot more stuff on our agenda over the next weeks and months, and we're going to do all we can to keep this state free. So we thank you all for having us, and God bless everybody.